The students, why coming late? I don't know. So last time in the nervous system, I have mentioned about some diseases related to central nervous system, right? So today I will give that day also I have given something in brief about prion diseases. But today I will give you a little bit in details because it is very important so far your examination is also concerned. So those group of diseases under this, caused by these prions. Prions, I have already mentioned you that these are infectious protein particles. Okay, so those are known as transmissible spongiform encephalopathy. Okay, and in this group of these diseases, as I have mentioned you that caused by the prions. These are the infectious protein particle, and commonly, in all this group of these diseases, one very common pathological changes in the affected animals, including human, it is highly zoonotic. Okay, so that is microscopic sponge-like holes, vacuoles in the brain. So that is very common. All the these diseases caused by this prion, commonly known as transmissible spongiform encephalopathies. And the common clinical sign is also the neurological, this signs, nervous signs, neurological signs. Okay. And under this, there are some, this human transmissible spongiform encephalopathies. Those are very old one that is known as Kuru. I'll show you, how it occurs and all these things. Okay, first, let me list down the this name of the diseases. So, human transmissible spongiform encephalopathies are Kuru, then Creutzfeldt-Jakob disease. In short, it is known as CJD, which may be familial type, sporadic type, or iatrogenic type. Okay, and the third one is known as a variant of Creutzfeldt-Jakob disease, VCJD. Okay, then the last two are not that much important. Okay, just Mann-Strasser, this Sinker syndrome, then fatal familial insomnia, but it may occur. So far the human transmissible spongiform encephalopathies are concerned. These are the 5 diseases caused by the prions. Then so far the animal population is concerned. 3 are very important. But here also you will have, you may come across 5 types of this transmissible spongiform encephalopathies. Those are, number one, there also I have given a little bit a brief idea about this bovine spongiform encephalopathy, in short BSE, and also known as synonym is mad cow disease, because the affected cattle, especially of course cow means mainly they used to show madness, like as in case of this rabies. Okay, and very much confused. When rabies or this BAC mad cow disease is there or not. Signs and symptoms are very much similar. So differential diagnosis is very much important. Then one very old this animal transmissible spongiform encephalopathy, particularly in case of the sheep, known as scrappii. That day also I have shown you the this alopecia, falling of the this wool, okay, from the body surface and all this thing, leading to very severe itching, and because of that they used to go rubbing their body surface to stationary like this this post or wall and all this thing. So this wool used to be set up from the they fall down from the body surface skin, so leading to alopecia. That is very much important. And the third important one is known as feline spongiform encephalopathy, FSE, in case of feline species. And other than these two, like chronic wasting disease, particularly in case of this egg and this deer, or this milk spongiform encephalopathy. Okay, so this may also occur. So these are the this common this animal transmissible spongiform encephalopathy, out of which 3 are very important, as I have highlighted in yellow color. Okay. Then now, so far this prion, last time I have mentioned, I mean, this given you a little bit idea how, I mean, these prions, the, I mean, what to say, this very, I mean, this infectious protein particle, I mean, this prion, that is proteinaceous infectious particle. So the normal protein, no, I mean, this cellular protein, PRPC, C stands for the cellular. Okay, this protein is a normal protein present in the normal body cells. I mean, this normal protein, and they are glycoprotein normally found at the cell surface inserted by plasma membrane. Whereas this kind of this normal protein, okay, so they used to be bind by, I mean, this dominated by alpha helices like this, alpha helices, this secondary structure dominated by this alpha helices, and it can be easily digested by the enzyme proteases. Okay, and whereas in case of this abnormal one, it is stand by the this symbol PRPSC. This SC stands for scrapii, the all prion disease that is transmissible spongiform and this encephalopathy, one of the very all that is known as scrapii, mostly in case of sheep, as I have already mentioned. Okay, so that use and that SC stands for this scrapii is used as a symbol for the abnormal protein, that the infectious proteinaceous particle, what we call prion. So the symbol used to be given as PRPSC. Okay, here also the same amino acid sequence will be there, okay, as the normal this protein structure, but only thing the transformational change what happened in this is that this is the normal one. See, okay, the normal this amino acid sequence in the normal this protein dominated by alpha helix here, okay, whereas in case of the abnormal protein, instead of this alpha helix used to be replaced and dominated by beta pleated sheet, beta conformation of beta pleated sheet like this. Okay, then it becomes what happened, I mean, abnormal and infectious in nature. Okay, so that means this normal protein PRPSG, when it as the abnormal one, when it comes into contact, it means after ingestion or after entry into the body and coming into the contact with a normal protein, that is PRPC. So it used to convert this normal protein into abnormal form. That means automatically in the amino acid sequence, which where the primary structure used to be dominated by alpha helix, that used to be replaced by conformationally replaced by beta pleated sheet or beta conformation like this. Okay, then it becomes abnormal. So this way they will go on attacking the normal cellular protein, and they will convert into abnormal protein. Then many of the protein in the body, I mean this, they will be changed into or they just converted into abnormal protein. This way the disease, I mean this by this infectious protein particle affect the this host. Okay, then this kind of this abnormal protein, as I have already mentioned, the normal cellular protein PRPC, that used to be highly and this easily digested by the proteases enzyme, whereas it cannot be this abnormal one. It is insoluble even by strongest solvents and highly resistant to, I mean, digestion by the enzyme proteases. So it can survive in the tissue after postmortem, this examination in the postmortem tissues, it may revive and this remain survive. Okay, and they are extremely resistant to even heat, normal sterilization processes, and sunlight, and it cannot be easily detected by the immune response. Okay, so this history is very important. That means I have mentioned you that this prion and the infectious protein particle was first discovered and I mean this by scientists known as Professor Stanley B. Prusiner, or I mean this simply, I mean this Stanley Prusiner also in that way also you may come across, and if you write Stanley Prusiner also no problem. Okay, So he got Nobel Prize in Physiology and Medicine in the year 1997 for his discovery of these very particular infectious protein particles, what we call prions. And he gave the name also. This prions means proteinaceous infectious particle. Okay. And he started his work in the year 1972 after one of his patients died of dementia resulting from the disease, the human and this transmissible spongiform, what we call Creutzfeldt-Jakob disease. Okay, 10 years later, he and his team, means when they are working on this, produce a preparation derived from the disease hamster's brain that contain a single agent called, then they have name as prion. Okay, and so for that, I mean, this history, as I have already mentioned, one very old, I mean, this transmissible spongiform encephalopathy in case of this human. So nearby, I mean, this Australia, this island, means you might have seen in this global and this map also, like world map. So that is known as New Guinea. Okay, Papua New Guinea. So New Guinea in the year during, I mean, this century and 19th centuries. So in those years, I mean, all time, very old way, I mean, this. So people used to practice cannibalism. That means when someone died, okay, I mean, of their relative or someone nearby, any, I mean, this, then they used to consume the dead carcass, the human dead carcass. Okay, so that kind of this cannibalism, it was practiced by those tribe people living in that area, New Guinea. Okay, Papua New Guinea. And those tribes are known as 4 tribes. 4 reasons this is known as. Okay, and 4 tribes. And they have that type of this habit or practice, and this, that is ritualistic. Okay, one kind of ritual. I mean, when someone died, they used to tag at the flesh of that very particular, I mean, this human, this flesh and all, right? And during the year 1957 to 68, almost, I mean, many people, around, and this 1,100 people died because of that and this infection. I mean, from that death, I mean, who died of, I mean, this very particular, I mean, this infectious protein particle and all, and they, when they used to consume, okay, they used to consume the flesh, and that contains this infectious protein particle. So majority of the deaths were found as human, this women, children, and elder one. Why? I mean, what happened is that as part their ritualistic and their custom, I mean, in those days and all these things, that the healthy, these young people and all these things, they used to take the good flesh and all these things. Whereas the women, children, and elder one, they used to take the offals or the the brain and all these things, right? So more chances were those people and the weaker group, I mean, these women, than children and elderly people, and they used to get those type of things, and they used to get infection more. And this difficulty in this disease is that the incubation period is very long, even more than 30 years. Means once they have got the infection through ingestion of those carcass and all this, right? The infected protein parts is not done. It will not show signs and symptoms and all these things. It may remain silent for more than 30 years. After that, they may start showing the signs and symptoms. Like that kind of this disease. Okay, so that was, I mean, about little bit about this guru. And in this very particular disease, some neurological signs, I mean, in the, this affected human and this thing, that is typically means they used to show, I mean, this body tremors. Okay, and one very particular thing is that laughing. I mean, this continuously. I mean, they used to go on laughing. That's why they used to say it's give the name laughing sickness. Okay, I mean, that is due to the this pathologic bursting of the laughter people, means which may this display when afflicted with this disease, means they will just go on laughing without any reason and like that. So that's why it is given as and given the name this laughing sickness. Okay, and the body signs symptom and this the madness type and this unmanageable behaviors and body tremors and all these things, right? And this very particular name and this terminology term kuru, it is derived from the four word those type. I mean this word this Kuria or Guria. Okay, that means shaking, to shake. Means as the this body used to show trembling or shaking when they are fat. I mean that is the very much classical symptom sign of the disease. So because of that, this very particular thing it has been given as this name Kuru, which has been derived from the four word those tribe. This word Kuria or Guria. Okay, and this widely this accepted that this disease was transmitted among the members of this four tribe who live there in the new this Guinea, Papua New Guinea, and during the funerals and all this thing, as their ritual, this ritualistic, this custom that cannibalism, having the this body, this carcass of the dead bodies of on those, these humans. Okay, so that is the main source, and having that this. Then next is about this Creutzfeldt-Jakob disease. As I have already mentioned you that three are very common so far. The human transmissible spongiform encephalopathies are concerned, and that one is what we call Creutzfeldt-Jakob disease. Okay, and in this, worldwide, this one or two cases in million people it may occur. Okay. And three different forms of this disease may be there, like one maybe spontaneous type, another genetic, due to genetic, or third one means iatrogenic. Okay, iatrogenic means when this using the drugs and all these things containing this kind of this material and all, and the wrong medication and like that way. Then average age group of the people affected by this is mostly it has been this reported and found that 65 years. All aged people. Okay, and the duration of the illness used to be 4.5 months. Means that much of this duration of the illness used to be. And so far the history about this bovine spongiform encephalopathy, that is, what we call this mad cow disease. In the year 1986, actually, first confirmed case of this PSE was reported from the United Kingdom. Then in 1980, that this all the this meat and bone meals, from ruminants for the preparation of the cattle feed, it has been banned. Then this importation of the this ruminants from the countries where this disease bovine spongiform encephalopathy that has been also banned. Then there was a peak of this incidences of this disease bovine spongiform encephalopathy in the United Kingdom in the year 1993, where this 1,000 new cases had been reported weekly. That must this it was highly what is a peak and this high peak. So like that, it go on and this is spreading to other parts of the European countries and all these things, and they have reported this kind of this diseases. Okay, and this please go through all this. I will not take all this in details. Okay, then I'll just come one this another important this scrapia, as I have already. It is a very old one. Almost it has been said that recognized almost more than 250 years ago. Okay, this disease, and it has been diagnosed years back. The year maybe in the this very long back. This it was this reported, and in the year 1947 in the United States they have also this diagnosed such kind of this this disease in the this sheep population. And when they just go on and just they surveillance when in the slaughter these animals, the slaughtered sheep and all these things. So they have found that overall national prevalence of this disease was 0.2%, and it was found that in black face sheep It means more cases were found. Okay. Then this is not that much this important history, and then let me come to transmission. Is I have already done. Human particularly means when they are consuming the cattle products, okay, the meat or the meat products and all these things. Infected, that meat means the animal from where they got this meat, and this meat products have been already infected by the this prion disease like this BSC. Okay, and that's why this kind of this disease, it is commonly known as Viren Creutzfeldt-Jakob disease, when particularly the brain and spinal tissue, okay, used to be mainly this affected one. And there may be some genetic susceptibility also, means some these human cases have been found that maybe they are homozygous for the mutation at the codon level of this 129 for this protein and this cellular protein. So they are more susceptible to those to this kind of this disease, Creutzfeldt variant Creutzfeldt-Jakob disease, due to the consumption of this meat. Particularly this kind of this people, group of these people having this codon this 129, okay, methionine level at the codon 129. So genetically it means some relation may be there like that. And there are some other possible route modes also for human transmission. That means transmissible is possible from the surgical instrument, which are used for the tonsils, appendix, and brain tissue removal and all. Okay, and sometimes by using growth hormone injections, where it has been prepared from the infected, this prion-infected animals, or sometimes through vaccines. So this way, and this human transmission, the other routes are also their possibilities are there. And there are some unlikely mode of this transmission to humans. It is not common, but possibility. Some this chances is another. Those are due to blood transmission during then consumption of the milk and milk products or gelatin products when manufacturing processes is done correctly. Okay, and then it is that much more. Otherwise, means it may also have chance, means particularly using those kind of this infected materials. Okay, then so far the transmission among the animals are concerned within the animals. Then the BSE, bovine spongiform encephalopathy. So when using the cattle feed, preparation of the cattle feed ration, okay, the sheep carcasses infected with the scrapie, if it is used, for the bone meal or the this meat meal for the this ration, or even the cattle carcasses infected with this unknown type of this transmissible spongiform encephalopathy, then there is a great chance because you are using this meat meal from this kind of this infected animal. Then another possibility is that maternal transmission at very low levels, means from mother to the offspring. It is possibility is there, but very low level. Then so far in case of this scrapie, mainly spread from the mother and this ewe to the offspring through placenta and placental fluid. And here also some genetic susceptibilities are also there. For transmission of this disease to the this healthy sheep. Then these are not as important, so I'll just skip it. This other mainly this BSC and scrapie. These two are more important. Okay. Then so far this human disease, as I have already mentioned you that this variant, that is Creutzfeldt-Jakob disease, and the classic form of this Creutzfeldt-Jakob disease. So I'm just giving this table, please go through it, and the average age of the onset of this disease, then duration of illness, and the possibility of mode of this transmission. Okay, means in effect this human population. Then the clinical signs and symptoms when means we are talking about this human variant Creutzfeldt-Jakob disease. So what happened is that initially the affected humans, persons, they used to be very much depressed and the schizophrenia like and this psychosis. Okay, little bit behavioral change, managed that. We used to say psychic like. Okay, then they will start showing neurological signs like unsteadiness, difficulty in walking, and involuntary muscle movements, tremoring, and all these things. Then it will go on progressing towards this immobile and totally mute. I mean, they cannot produce any even sound and all this, right? So this way, I mean, they may have this kind of this clinical signs and symptoms, and this is about, I mean, this diagnosis and all. So far, I mean, this antemortem diagnosis for the variant and this Creutzfeldt-Jakob disease. So being at this neuropsychiatric disorder within with the duration longer than more than, I mean, this 6 months and all. So specific clinical signs for this involving this nervous and behavioral changes and all these things, that is important to be noted. But I mean, you have to go for this EEG, okay, this encephalography. So by that, I mean, this you can measure, I mean, you can see this condition of this brain. Then another technique is tonsillar biopsy for the detection of the prion protein. That way means it can be diagnosed in this laboratory. Okay, then some postmortem and this definitive diagnosis is that, I mean, some amyloid these plaques, the proteinaceous particle, and this amino plaques used to be present, which has been surrounded by vacuoles, as I'm showing here. So empty vacuoles, white, and this vacuole, these unstained areas. Okay, within that, this amyloid plaques are there, protein particles. Okay, and this prion protein accumulation, it is mainly found mostly in the cerebellum, and the spongiform nature appearance is more in the gray matter. That means the empty vacuoles and all these things. Okay, so that will give, I mean, grossly the brain in the spongy nature. So this kind of this vacuolation in the brain tissue, it is one of the most important microscopic picture. Okay, so grossly means you may have only this spongy nature, otherwise not much this gross lesions. But when you conduct, I mean, this microscopic examination under the microscope by making section and all this, so this vacuolation, okay, I mean, just around the amyloid plaques and the empty vacuoles are there. So that used to be more common in case of the, I mean, at the gray matter part of the brain. Then treatment, I mean, it is not that much important so far pathology is concerned, but you just go through it. Okay, then in case of this animal population, as I have mentioned you that different type of this transmissible spongiform encephalopathies, but 3 are more important, but 2 I like, and this Sclepiae means affecting the sheep population. So the incubation period used to be 2 to 5 years. So far, in case of, I mean, this bovine spongiform encephalopathy or mad cow disease, so it may be 2 to 8 years. Okay, then and this feline spongiform encephalopathy is unknown. Mostly, maybe, I mean, this 4 to 9 years of this age, means it may be. And I mean, this chronic wasting disease. Then this mink, this transmissible mink spongiform encephalopathy. So like this 5 type of this this transmissible encephalopathies means you may come across in animal population. So in case of this clinical sign about this, I mean, this bovine spongiform encephalopathy, Sclepiae, and this. So initially, most commonly means in all these cases, so behavioral changes with increased excitability, nervousness, aggressiveness, and very much increase this sensitivity to noise. When you make noise and even clapping and all this thing, they used to be highly this active and this hypersensitive to that even noise and sound, right? And they may have this increased excitability, nervousness, and aggressiveness. I mean, this, okay, very much aggressive. Then particularly in case of this Sclepiae is that severe itching, madness, and the type of itching, pruritus, what we call, and they will go on rubbing their body surface through this objects like wall and this post and all these things. Because of that, the wool may just fall down, so leading to alopecia. As I'm showing one picture here, rubbing the body surface because of this itching, pruritic this condition, right? So these are the pictures showing that Sclepiae means last time also I have shown you in the nervous system, right? alopecia, and this where these wools are falling down from the body surface. So this is very common and very typical and the sign of your scrappy eye. Then in the terminal stages, they may have developed, this hypokinesis, hypometria, falling, and the general paralysis. This paralysis, this all limbs, 4 limbs, may go on paralytic condition, and they may show tremors and trembling in this muscle fasciculations, particularly the neck and the face area. Okay, and they may go on wasting despite of this good appetite. They may go on wasting their body condition, running down, running. Okay, when they are having even good appetite and all this, but they cannot gain weight and all this thing. They will just run. Running condition. The body and this will be wasting their muscular and all this thing, right? And in the terminal state, particularly in case of chronic chronic wasting disease. So deer and elk mostly they are just having this kind of this disease condition. They may show increased drinking and urination. Okay, and particular disease, this bovine spongiform encephalopathy. Sometimes you may ask to write and this sort out on this, right? Okay, so those cows particularly affected with this disease may show loss in body weight, then reduction in milk production, these behavioral changes like restlessness, nervousness, fearfulness, and start to bite. Like this rabbit animal, a rabbit. Okay, they may bite. Then disorders of this sensitivity may be this loss, some disorder where they loss out. The hind foot are touched with a broom, means just the hind limb. Okay, they were just kicking, or striking, like the slap, this last out, and striking with the head and the horn by, and the grinding of the this teeth when touched with a pencil on head and neck. Means by using a pencil, you just touch the head or the neck portion, and they are highly sensitive, excited this condition, right? So in that condition, they may show, this striking, just shaking and striking of the head and the horn, or this another is that grinding of teeth. Okay, this is very much typical. And sudden noise, when you make a sudden noise, clapping and all these things, then they are also this hyper excited and this highly sensitive to that noise also. Like then, so far disorder of this motility, movement and all these things. So they may go on ataxia. This incoordination of movement, they cannot this have proper balance and all these things. Then plunge down and impossibility to stand up. Once they fell down, means they are unable to get up. Okay, so this type of this, this signs means you may come across in case of this cows affected with these prions. This in case of this mad cow disease of bovine spongiform encephalopathy. And more these signs and symptoms are there in this, like when they are this more walking and all this, they will lose all this balancing. Okay, then the animal may start running, lashing out during the milking, this kicking and all this when you go for milking. Then excessive licking of the nose may be there. Then Google eye, just rounding and this moving and the eyeball in rounding like this Google eye condition. Then they may refuse to cross even a small ditch and jump. When you force them to cross a small canal type, this nala type, right? So even they may not think that it is a very small this ditch. Okay, so simply they will not just cross, they will just jump, sudden jump over the this thing. Then they may refuse to cross the door of the stable. Okay, followed by a sudden jump through. In that case also, right? So these are some of the these pictures showing this here. This ataxia, hypermetria. In case of the this infected cow with this prion disease, bovine spongiform encephalopathy. Then here this Google eye condition, like this nervousness, showing this nervousness with this excitability and all these things, right? Then paralysis. Initially this postural limb paralysis, then later on for all limbs, okay, paralysis may be there. All limbs may be paralyzed, and once they fell down, then they will not be able to get up. Okay. So this is not that much important. I will not. I'm just go to please go through it. This then this feline spongiform property more or less same. But when we are talking about this post-mortem examination, post-mortem findings, yes, I have already mentioned also. There is no any specific or characteristic gross lesions, but so far the microscopic picture is concerned, that speculation, as I was talking about, like this empty vacuoles, wide and this area where stand, it is not taking stand, right? Okay, mostly in the gray matter. Okay, so this is very much characteristic, means speculation, presence of these vacuoles just around the amyloid protein plaques surrounded by these empty vacuoles. So this will give the brain as a spongy nature. That's why the name is spongiform encephalopathy. So this is nothing but due to the this formation of this vacuoles, vacuolization, maybe bilateral or symmetrical type. This when you see the two hemisphere of the brain, and mostly it used to be confined to the gray matter. Okay, and most of the cases means in all these transmissible spongiform encephalopathy, maybe in animal, maybe in human. So this is very common, and this characteristic microscopic lesion. Okay, vacuolation, vacuoles in the brain tissue. So these are some more pictures of vacuolations in the brain tissue, right? This empty vacuoles, oval or rounded little bit, and these unstained areas. Okay. And this is one kind of this picture for this detection of the proteinaceous particle by this different this techniques. And diagnosis means in general, of all this and this spongiform encephalopathies. So post-mortem examination, if you conduct that, so from that the tissues and all this in brain tissues and all, particularly during the post-mortem examination. So for the detection of these prions, particularly you have to go for microscopic examination by making this section, then staining and all, then you can detect the vacuolation. And so far in case of this live animals, one technique that is tonsillar biopsy, particularly in case of these deers. Okay, but it is highly this time consuming and very expensive and all. And another technique is the third eyelid test, as in case of this sheep, which it can also be done. And the third eyelid tissue, some liquid tissue there, which used to show the this presence of the amyloid plaques and all these things, and stain with by some specific stain, and then you can produce neuropils, this affected protein particles of prion protein, and this that is Scrapia one, this infected one, right? Then so some blood tests also can be just conducted. So this is about that, the third eyelid and this tests for the that and this some collection of the tissue from this third eyelid should be done, and a small piece of this lymphoid tissue from this third eyelid used to be removed, okay, from inside the this third eyelid and all, and that can be utilized for this immuno this chemistry and this detection of the this amyloid proteins and all this, right? So like this means from the lymph nodes also means it can be, so the discoloring these antibodies of this very particular protein and this prion proteins in the intracellular tissue of the infected sheep, like this. Then lastly, differential diagnosis. As I have mentioned you that there are some more diseases, and you may come across some other viral or some other disease condition wherever involvement of the central nervous systems are there. So in any case disease where the CNS, central nervous system, is involved and affected, so the neurological signs are more or less same. We cannot simply say that it is due to rabies, it is due to listeriosis, it is due to even your brain tumor or metabolic diseases like this nervous ketosis, this hypomagnesemia, or this very particular disease, bovine and this transmissible spongiform encephalopathy. So it may be polyencephalomalacia also, or this necrotic tissue, this necrotic, this changes about this your this gray matter, Then cerebrospinal cortical, this necrotic changes, maybe it may be in case of this poisoning cases due to lead also. So that's why nervous involvement, I mean this nervous signs, and this may be of different kind and different origin, different causative agents. So these are some of the common, I mean this, which may have similar type of this nervous signs. So that's why we have to go for and this rooting out this very particular transmissible, responsible encephalopathy from these nervous diseases. Okay. So these are metabolic diseases like nervous ketosis and hypomagnesemia, rabies, listeriosis, brain tumors, polioencephalomalacia, and the cerebrocortical necrosis, then lead poisoning and all this, right? So just so many collections are there. So please go through it, prevention and control and all these things. So these things also it is important, of course, to be noted down. But so far, and this pathology changes and all these things are concerned. So it is not, I mean, that much. I mean, important so far. I mean, this pathology is concerned. So, but later on, I mean, when you learn the medicine and preventive medicine and all things, so it is important to be noted and to have this. Okay, so that is about this prion diseases in brief. I mean, not in much in details. So it is one of the important, and this so far your examination is also concerned. Some questions you may expect, I mean, from this also prion diseases, particularly from the history side, like your and this discovery of this prion first by your and this Professor Stanley B. Pruginer in the year 1997 and got Nobel Prize on this also, like. So these things are some important point, right? So that is about, I mean, these prion diseases, and that's all for today. Okay. So okay then. Thank you.
Thank you, sir.
Thank you. Thank you.